This is the second in a series of presentations that we're doing on Renuvion technology. I'm Dr. Gregory Buford. I'm a board certified plastic surgeon and published author of Beauty in the Business and Eat, Drink, Heal, as well as the founder and medical director of Beauty by Buford. We picked up this technology a few months ago and have been extremely pleased with the results so far and look forward to sharing some of our results as well as some information about this exciting new technology with you. So with that, without further ado, I'm going to begin this presentation. So let's learn a little bit here. So again, for those of you just joining us, this is Renuvion. The future of skin tightening is here. As a board certified plastic surgeon, in my training and in my experience of almost 20 years, the holy grail of body contouring has really been skin tightening. And we've gone through a number of devices, many of which have been very unsatisfying with respect to ultimate outcomes. And ultimately, really the only thing that we've had at our grasp for tightening skin in the past has been actual skin excision, which requires lengthy excisions at times and is not always something that the patient is really looking for. So with Renuvion, which utilizes helium technology and RF energy, we're able to actually not only tighten skin, but address changes that we see with the aging process, as well as with pregnancy, weight loss, and so forth. So Renuvion, the future of skin tightening is here. So a little bit about me. I'm a board certified plastic surgeon. I trained at Georgetown, Cleveland Clinic Foundation, 2 residencies, did a fellowship after this, an anti-aging fellowship after that, followed by training at the Physician CEO program. And again, I'm the author of Beauty in the Business and Eat, Drink, Heal. These are my conflict disclosures. Just so you know, I am a national speaker and trainer for Apex Medical, which makes Renuvion. So before the COVID crisis hit us, this was actually myself and a bunch of friends training in Bogota, Colombia. The gentleman in the gray scrubs is Dr. Alfredo Hoyo, one of the top physicians, plastic surgeons in the world, who has been using Renuvion for several years. I had the opportunity to train directly with him and a number of my peers. Most of these guys are from Orange County, and learn really how to use this as in an advanced manner to effectively tighten skin. So great training, and a big shout out to Dr. Hoyo. Thank you for hosting myself and my fellow peers. So what is Renuvion? Well, Renuvion is a cosmetic technology, as I mentioned just previously, which combines the unique properties of helium plasma with RF energy. It's a tool used for the cutting, coagulation, ablation, and dissection of soft tissue. But most importantly, it's a very effective way in which we can actually tighten skin. So I'm going to watch this video now.
Is reshaping what's possible for your practice and your patients. Renuvion allows for the application of heat to tissue in a way that was never before possible. It is used as part of a minimally invasive procedure. The device is inserted under the skin and activated in a retrograde fashion. As the device is drawn through the tissue, plasma stream couples with and delivers energy to the closest tissue or structure.
And this is right below the skin within the subcuticular space. So this is tightening the area below the skin.
Contact with the helium plasma itself. And the second is with the flow of the proprietary RF energy through the plasma and into the tissue. During application, the vast majority of the energy is delivered directly to the fibroseptal network, which maximizes soft tissue contraction. This technology is unique in that it can quickly heat the subdermal tissues to maximum contraction temperatures while minimizing thermal diffusion to the skin surface. Collagen contraction is resulting from the controlled heating, which allows for some immediate tissue contraction, but full long-term effects will not be seen for 6 to 9 months as the body goes through the healing and neocollagenesis stages. Renuvion, reshaping what's possible.
So it's nice, and you're going to see this in action in an upcoming video. We can actually not only tighten skin over the long term, but you actually see this on the table. So in other words, whether I'm doing this in the office, which we're actually doing a number of procedures, jawline, arms, abdominal wall, We're also combining it with liposuction as well too, in a more extensive manner and in the operative room setting. But regardless of where we do this, you can actually see tightening on the table and the media. That only improves further over time. So let's talk a little bit about plasma. What is plasma? Well, matter can exist in a number of states. It can be a solid, it can be a liquid, or it can be a gas and plasma. So with this technology, we utilize helium energy, which then is activated by RF, radio frequency energy, to create very high energy plasma. And so this cartoon gives you a little bit of an idea of what happens. These electrons spinning around, radio frequency energy activates the gas and converts that into a plasma high energy state. This is very, 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 very fast. The instantaneous increase in temperature then actually stimulates collagen promotion and tightening ultimately of the skin. As far as a product history, patients always ask, how long has this been around? Is this something that's brand new? Well, as you can see, this was developed back in the late 90s and since has undergone a number of evaluations for dermal resurfacing and ultimately placement underneath the skin. And this is where we're using this most. But a number of people are actually using this as well too, in a very similar manner as a laser to actually resurface skin. So this can be used in a number of different ways to achieve rejuvenation, depending upon type of tissue treated and area of the body. This is the temperature time data points. What this effectively shows is an almost instantaneous increase to a very high temperature within the contraction, the tissue contraction zone. Why is this important? Because the slower that we heat the tissue, the more that the skin itself, the overlying skin, actually gets heated up. As this gets heated up, if we do not monitor the temperature of the skin, we can actually incite burns. What I can tell you is, having done this enough times, what's amazing is you do get energy produced underneath the skin. You actually see light energy from the helium gas. But when you feel the overlying skin, it's actually cool. This is important because it reduces the risk significantly for skin burns, which was a big problem when we were doing more bulk heating. And this gives you an idea of previous devices. This is instant tissue heating versus bulk. Bulk tissue heating can take a while to heat the temperature up to 65 degrees. Renuvion actually heats the temperature to 85 degrees, and again, does this almost instantaneously. Once this does this, it addresses the subcuticular tissue, the retinacular tissue that's actually the mesh framework underneath the skin. It tightens that, stimulates overlying skin contraction, but again, does this in a safe manner to avoid skin burns. So why is 85 degrees better than 65 degrees or 70 degrees? Well, greater contraction, as you can see here, can be achieved with higher temperatures and shorter treatment times. And I want you to take a look at these statements. I mean, these are pretty powerful statements. At 65 degrees, collagen contracts 40% in about 2.5 minutes. And that's a fairly long time. Skip down to the third statement, though. At 85 degrees Celsius, collagen contracts 60% in 0.044 seconds, okay? So in other words, when you're treating tissue at 85 degrees, you achieve 50% more collagen contraction, about 3,500 times faster when compared to a treatment temperature of 65 degrees, and 50% more collagen contraction, and about 1,000 times faster when compared to a treatment temperature of 70 degrees. So what you're saying here is not only safer treatment, but also greater efficacy of skin retraction. So safety by design. What you're saying here in the thermal video is basically the heating up of the tissue by an infrared camera. We use the FLIR camera here, and you can tell that it actually gets warm. But what you can also see as well too, that the max degrees on the skin, this is not below the tissue. Keep in mind the skin doesn't heat up to the same degree, but within the tissue, it's 85 degrees. Outside is 35.1. So this obviates or eliminates the need for external temperature monitoring, which we had to use with prior technologies. And we'll show you in this video, you can see how it's being tracked subdermally. So in other words, underneath the skin. And the heat is very localized in a focal area. But again, never goes above mid-30s, which is extremely important because, again, this avoids the need for skin monitoring and reduces a risk for skin burns. So unique energy delivery, the newer ports actually have circumferential release of energy with the twin port handpiece. Two forms of energy delivery. We have direct contact with the helium plasma, and then with the flow of the proprietary radio frequency through this plasma to the tissue, achieving a 360-degree energy application to all tissues. When it treats the trabecular fibers as well too, it only treats it once. It then goes to untreated tissue, so you don't get char, you don't get it focusing on just one area. The rounded tips, this is one of the newer tips, minimizes insertion force in blunt impact on the tissue. It's a smaller diameter shaft. Why is that important? Because we can treat jawline, we can treat a number of areas with very, very small, very small openings, so not very large incisions. So let's look at case examples. That's nice technology, but what does it actually achieve? So, this is an abdominal wall. I think this is actually pretty impressive because we're looking here at about a year and a third, essentially. So a year and 2 months. Nice tissue tightening. I have another case, actually you'll see in a minute, very similar. This patient had a combination approach. Small amount of liposuction. Ultrasonic liposuction was utilized to remove about 150 cc's of fat. Those of you who know the volumes know that this is a very, very small amount. And then Renuvion was used to effectively tighten the tissue. And again, this is over a year out. Same patient as well too. And you can see from the sides, really a nice circumferential result. So here's one of my patients.
I am a 47-year-old mom of 5 kiddos. I was shocked to see anything at 3 months, so I can't wait for the year, actually. Definitely worth it. So I'd encourage you, if you've had any kind of weight loss, any kind of multiple pregnancies, any areas that you have skin that's sagging, get a consultation. I definitely think that it is worth your time and worth your money, and I think that you'll see fantastic results.
So this patient underwent Renuvion alone, no liposuction. As you can tell from her before photos, she has very little fat to her abdominal wall. She's 47 years old, as you can see as well too. She's had 5 kids, very active woman, very low body fat overall, but loose skin. This patient in the past potentially would have been considered for a tummy tuck. The problem is she really doesn't have enough skin for a tummy tuck, so this would have been a very challenging procedure. As you can see though, this result a few months out is very acceptable and will continue to get better over time. Another video here from the company. So, what you're looking at here is 7 months post-op, and I want you to focus, not only on the result, but also too, look at how tight that skin is. In the past, again, this is not a tummy tuck. This is the kind of result we get actually from excisional surgery, and certainly not from any devices previously. So again, I'm showing you results to show you that this actually works. This is 4 weeks post-op. We actually tell patients 6 to 9 months is, really when you see the final results, but it takes about 90 days for collagen contraction and collagen stimulation to occur. But at 4 weeks out, you can actually already see a very nice result. And again, not only was Renuvion utilized, but also a very small amount of liposuction. In many cases, such as the example that I showed you, we don't actually perform liposuction. Liposuction cannula is replaced only to create tunneling and basically an open area for the Renuvion gas. But in many patients, though, we don't have to remove a lot of fat. We can just use the Renuvion. This is 10 weeks post-op, and this is 175 cc's of fat removed. You can still see the small ports, the little scars here. Those heal beautifully over time. But again, a very, very nice result. And again, only 175 cc's of fat removed. So a very, very minor amount. This is one of the biggest reasons why I actually purchased the device. One of the biggest reasons is that I get a lot of patients in their late 30s, early 40s that don't necessarily want a neck lift. They've started to get early jowling. This patient's a little bit older. She's 54 weeks, or I'm sorry, 54 years old. She's a year and a half out. You can see from this, she underwent ultrasonic liposuction. Doesn't say how removed, probably not a lot, because as you can tell from her pre-op photos, she did not have a lot of fat, but in combination with Renuvion was able to achieve a really nice result. If you look at that jawline, she has a lot of refinement and a very, very sculpted look. So overall, a result that I would have been very, very happy with for my patients. Here's our patient, Sarah.
I first learned about Renuvion from Dr. Buford when he was looking at the remaining loose skin on my thighs and jawline area. My only option with the amount of skin I had was to do an invasive thigh lift and face lift, or to give Renuvion a try. We had discussed using Kybella for my jawline, which would address fat, which I didn't have much of, but not the loose skin that really bothered me. At 32, it was hard to rationalize a facelift and recovery time from going back into the OR, and it was just unappealing to me as far as cost recovery, etc. In November 2019, I had the Renuvion on both my thighs and jawline in the Beauty by Buford office, and I can definitely see significant changes in both treatment areas. The procedure took a few hours with minimal discomfort. I will say my jawline was a bit more uncomfortable as I had fibrous tissue, but it was far from unbearable. After the procedures, I rested for 2 to 3 days before returning to household chores, and I was back in the gym at day 10. I was quite swollen for about a week, but not much discomfort otherwise. In about a month, I started to see results along the jawline, and the thighs were noticeable at about 3 months. I am now 5 months post-procedure and quite pleased with my results. I should mention that I've also gotten leaner since the procedure, which I think has further enhanced the outcome, especially for my thighs. I am excited to get my 6-month photos taken next month, and overall happy with my experience, as I always am with the Beauty by Buford team.
So stay tuned. As I mentioned, Sarah will be with us, and you can ask her any questions about this procedure. I wanted to give her the chance to basically kind of share her experience. I can tell you in my words how I think it's very, very effective, but I think it's more powerful hearing from someone who's actually undergone this. So here's a neck case. I want you to take a look at this. So, the most important thing is notice how, and this is on the table. This is not a year out. This is actually on the table. It shows essentially how tight the skin actually gets right after treatment. Pretty impressive. Some more cases. Example 4, there's a 51-year-old male, 100 cc's of fat removed and ultimately Renuvion performed. Again, really nice result at about just shy of 6 months out. Nice jawline, nice submental curvature and angle. Another nice case. Look at this one. Look at underneath. How much tighter she is. And also, too, how much more refined the jawline. And again, amount of fat removed, only 20 cc's, which is very, very little fat removal. Another case, a heavier neck, 100 cc's removed. Is it a perfect result? No, it's not. But pretty impressive. If you look at the pre-op photos, she had very little to no definition to her lateral jawline. Now you can see the angle of her jawline. And this is actually even a patient that I would probably look at about the 1-year mark, maybe going back in and doing a second treatment. Usually, and patients always ask this, how long will it last? Do I need to have a second treatment? Most patients undergo one treatment, but sometimes when you want a little bit more dramatic result, or you start with a little bit more skin laxity, a touch up at 1 year, 2 years actually can be recommended and can be very efficacious. Another example as well too, and this shows you basically how quickly you see the results, and this is a nice result at 1 week out. This is a 40-year-old female, 40 cc's of fat removed. So, a mild amount, in fact, actually I'd say a very, very mild amount of fat removal. Generally when I'm in the OR, I'm removing around about 100, 200, maybe 300 cc's of fat. So 40 cc fat removal is actually pretty conservative. Another gentleman, what I find impressive about this is this gentleman is 60 years old, and you can see his skin is very sun damaged, so you'd think that this would not give him a great result. In contrary, this is 5 weeks post-op, and she has nice shadowing of the jawline. Is it a perfect result? No. I mean, could he have gotten a neck lift, maybe a little bit more result? Yeah, he could have, but with the associated scars, associated downtime, and significantly more expense. So again, very, very nice results from our local doctor, Lisa Jenks. This is 3 weeks post-op, 100 cc's of volume removed in combination with Renuvion. And again, early result, which will continue to get better, but nice shadowing. I really like this result. And again, one of the main reasons why I brought the device on for you, my clients. 6 months post-op, a little bit more fat removed, 150 cc's, Renuvion followed, and again, 50-year-old patient. This patient, 6 months out, 10 cc's. What I want you to look at is, look at this patient's age. This is a 75-year-old patient. In the past, if I saw her neck, I would immediately have referred her to one of my colleagues. I don't do neck lifts and facelifts anymore. This to me, would have been a neck lift patient. But again, very, very nice result. I probably would go back in about a year and treat along the jawline as well too, to get a little bit more refinement. But I mean, that's being hypercritical. I'd say overall, very, very nice result. And again, the type of procedure that can be performed in an office setting in literally under an hour. This is another one of our patients. This patient didn't start with a lot of fat or skin laxity. She's young. She's 35 years old. I performed Renuvion alone without any fat removal. And, when she came back in, I asked her, what her thoughts were, and remember that she didn't have a lot of aging along the jawline. And I saw a nice result, but was really impressed when I saw the pictures side by side. That really shows the shadowing, the differential in terms of the appearance of the jowls. I mean, her jowls are almost gone. Again, young female, but this is a type of patient that we're seeing literally on a daily basis. The thigh gap, look at this. This was 1,100 cc's of fat removed. I mean, now when you remove that much tissue, especially in a 53-year-old, and if you look here, there's a lot of loose skin. You worry about making this even worse. Again, in the past, this is not a procedure that I would have performed with liposuction. I would have done some type of excisional procedure, okay? This is 5 weeks post-op. You're seeing some nice healing, most likely some progressive skin contracture over time. And again, a nice area. Medial thighs are a really great area. Arms as well too, and we'll show you some examples of arms in just a minute as well too. So very versatile device in a lot of areas for application. So, without further ado, the arms, the 6 weeks post-op, 600 cc's of fat removed. This is a bariatric patient, so a massive weight loss patient, 32 years old. You can see that the quality of the skin is not great. But again, in the past, this would have been a patient that I would have performed a brachioplasty or an arm lift. The brachioplasties produce very nice results, but the problem is they also produce scars, okay? Whether it's a limited scar or a full brachioplasty arm seam scar, this is a much nicer alternative. And hats off to the doc for a great result. Another result, and again, this is a 69-year-old patient, so we're getting up in the 60s, the 70s with very, very, very nice results and nice tightening of the skin. This is about a month out. And again, when you look at about 6 months, 9 months, you get progressive improvement, but really nice improvement in the overall contour of the arm. Another procedure, another result at a year and 3 months from Dr. Kevin Dubelchain. Great result. And combination of Renuvion plus power-assisted liposuction for removal of about 250 cc's of fat, which is a little bit more done than on the previous ones. And if you note as well too, the Renuvion procedure was only done on the left arm. Big difference in terms of appearance. So it really shows you the power of Renuvion. Another arm case as well too. This is 6 months post-op. Patient was 26 years old, so a young patient. These patients respond beautifully because they're young, they're healthy, they have great skin tone. Amount of fat removed was about 900 cc's, so just under a liter. Let's look at it on abdominal tissue as well too, and this will give you kind of a hands-on look at what's actually happening. So, as Dr. Ruff takes this through a tissue sample here, you can see the tightening. You can see the light there as well too. We call that an electrical storm. The plasma basically skips to different areas. Once it treats one area, it doesn't go back and treat that area again. So much less chance for burns within the subcutaneous space. And as we talked about before, there's also significantly less risk for skin injury because the skin only goes up to mid-30s, maybe 41 degrees at the most, whereas we can achieve temperatures within the mid-80s centigrade within the subcutaneous space below the skin. I hope you guys, submit your questions for Sarah. I'm going to turn Sarah on now here. So Sarah, you're unmuted. I'm going to have you start your video. Okay, much better, much nicer to look at than me. So you guys, so Sarah, tell me a little bit about your experience. You did the voice, so forth. Tell us a little bit about why you did it. Would you do it again? Were there any things what would you like to know if you were going to go into this? What should potential patients know about the treatment?
Sure. So, a little of my backstory is I had weight loss surgery and I lost about 70 pounds. And I met you shortly after. And since then, we've worked together to do a lot of reconstruction of my body. And one of the last things was that my thighs and my jawline really still bothered me. And we had talked about a thigh lift. I think I was pushing in that direction. And you said that it was not a good idea, considering the recovery, the amount of skin, all of these things, it being a dangerous area. So when you mentioned the Renuvion, I was definitely interested because it kind of felt like my last hope. And it was something that I couldn't out diet or exercise. So the procedure, I have nothing bad to say about. It's a little freaky to be awake for, but you were really good about talking me through it. There was no real pain during the procedure. There was definitely no pain. There would be times that I might feel something and then I would tell you I'm feeling this, and then you would numb me and go back. As far as recovery, I would say the day that I got home, I was laying super low. I was quite swollen in my face for, I want to say, 3 days. And from what you communicated to me, it was because I was pretty fibrous in there. And correct me if any of my language is incorrect here.
You're doing great.
So because of that, I was just really swollen for a good 3 or 4 days. But I was off pain meds by day 2. And then I was up and doing normal chores by day 3, and I was back in the gym after I came for my follow-up at 10 days. I had a couple small incisions, just right here, and then one here, and then there was 2, there's 4 on my thighs, sorry. And it was 1 stitch, not a big deal. But generally speaking, going through the process was not scary at all by any descriptor. And the recovery wasn't bad. And then getting to my results, I'm just about at the 6-month mark now. And the photos, I think, in those pictures were maybe at 3 months, and I've seen even more progress. And so I would absolutely do it again. I think you and I have touched base on actually going in and doing my upper abdomen area that we couldn't get with the tummy tuck. And it was overall a great experience, and I would have no regrets in doing it.
It's funny, actually. I'm going to comment on what you were saying. You've done the Renuvion in a couple of areas. Now you're finding different areas as well, additional areas. We've had the same feedback from a number of patients, that have done their arms, their jawline and so forth. And they come back and say, you know what, I was really skeptical initially, and I got such great results. Hey, can we try it on this area? Can we do it on this area? I don't want to say it's addictive, but I think patients, when they see the actual results and they see, you look at the before and afters that I showed tonight, they're pretty impressive. But actually being a patient that's undergone it, though, didn't you think once you'd seen it, you're like, wow, did this meet your expectations or beat it? What would you say?
Exceeded. And really my only other option was surgery. So maybe I could have gotten a slightly better result if we did surgery, but I'm 32 years old and getting a facelift is just crazy.
Right. And all the and we hear this all the time. I mean, you're in my perfect patient population. So we're getting a couple questions here. Is there numbing with procedure? Great question. Absolutely. So first of all, I give my patients some oral sedation, basically just to help you relax. Play music during it as well too. Anything but country. It doesn't drive me crazy. Keep you relaxed as well. And then under the skin, we actually use a tumescent. So the tumescent solution is the same liquid solution that we use in the OR for liposuction. What that does is it reduces the amount of bleeding. I mean, we rarely get any bruising at all. Patients are very, very comfortable because this actually provides nice anesthesia during the procedure. We don't blow you up that much. We just want enough to get you comfortable, and then we melt the rest of the fluid out. So you may get a little bit of drainage. Did you have a little bit of drainage afterwards from your incisions, much of anything?
And I had zero bruising, but I did have like that jiggly thigh thing for a couple days.
Right. We've got another question.
I was awake for the whole procedure, and I was talking to Caitlin, and I was like, I think I was pretty in. I mean, you can tell me, but I think I was pretty in touch.
No, you were totally in touch. I mean, we were guiding you through this. I mean, I only recently actually started using a little bit of relaxation just because, feedback, you said it was, it was comfortable, but overall it would actually be a little bit more comfortable, being a little bit more sedated. And that's the only reason why we're doing it. It's not a real painful procedure. I mean, for pain medication, what did you take when you were done, and how long?
So I know I took like 5 milligrams Valium for the procedure.
Okay.
Then, let's see. It looks like the day after the procedure, I took Valium because I was feeling tight in my jaw. But then the second day, it was nothing.
Perfect.
Not even Tylenol or anything. I've documented this day by day for the first week.
Yeah, you got to thank you, Sarah. You've done this for me for a few other procedures as well too. Sarah's great because she actually records everything, documents everything. So, you're not getting this raw. It's basically, I had this done. Here are the results. Here's exactly what happened, which as a patient, I think is very helpful. Next question, is a treatment done at a surgery center or office? We actually do this both. If I'm going to do greater areas, say like 3 or 4 areas, or 5 or 6. I mean, I had a case a few weeks ago where we did about 7 or 8 areas. That's done more in an operative setting. And it's just because it's a lot easier to do it time-wise. Patients are a little bit more comfortable. If we're doing more isolated areas, for example, the jawline, the neck, the arms, inner thighs, abdomen, we can do 1 or 2 of those areas in the office. If we're going to do substantial liposuction with it as well too, then I usually go to the OR. We've got another. Go ahead.
That a dentist cleaning was more uncomfortable than this procedure. Seriously.
Who do you go to for your dentist? Good Lord.
Well, I'm a little bit scared of the dentist, and I'm not scared of you, so I guess there's that. Yeah. But as far as discomfort, like really, that it's not uncomfortable.
Perfect. It's weird. So we have another question. Can this be done on all skin types? As far as we know now, yes, it can. So, our patients with darker skin types, we're less worried because the skin does not heat up. We're less worried about what's called post-inflammatory hyperpigmentation, or PIH, which can happen, in darker skin patients. We haven't seen that. And from querying Dr. Hoyo, when I was down with him in Colombia with the group, and others across the nation, that's not something that we're seeing. Now, I can't speak to, the use of Renuvion for surfacing. That's a whole different thing when you're using it outside the body. When you're using it inside, internally, we have not seen that. So other questions. What other questions do you guys have? And Sarah, anything that you'd like to add more as well too? I'm putting you on the spot here.
I don't think so. I mean, just that I'm ready to come and see you in 2 weeks. And then we can pick the next spot to do it.
There you go. Well, let's see here. So I think we've got one more. No, I think that's it. Well, like I said, 20% off for those who register for the Renuvion procedure within 24 hours of this web. This will live talk with lovely Sarah, my charming client. So a real person, real story, real results. Stay tuned. If you guys have any questions as well too, email us at drbuford, that's Dr. Buford at beautybybuford.com. We look forward to working with you. Have a great day. Stay healthy, stay educated, stay safe, and we'll see you soon.